You know, we were talking about macular degeneration. In fact, we've been talking about it for several months now, as we've had visiting eye doctors from across the valley come here, talk to you about a number of conditions, but macular degeneration continued to come up. And so I found myself with a swab in my mouth, not as a result of my colleagues here asking me to stop talking, but simply because that's the way now the DNA test is done to determine where you are from the standpoint of your risk for macular degeneration. And Dr. Gary Morgan is back now with the McMahon Group. So I was tested, and I think before we ever talk about my test, because I know some of the results, but you're going to surprise me with some of the other ones today. So let's talk about the condition. What is macular degeneration and who gets it?
Well, macular degeneration is basically a disease of oxidative damage to the retina over a person's lifetime, exposure to sunlight. And there are two forms of the disease. There's the dry form, which everybody starts out with and is the less serious form. And then there's the wet form, which is when the tissue metabolism slows down so that a new blood vessel grows into the retina to try and help that metabolism. But essentially, it can destroy the central vision if it's not caught early.
So we're talking about blindness.
Blindness. Yes,
How
sir.
many people? Is it a serious enough problem that people underestimate their chances of getting it?
Well, with our aging population, you know, as the baby boomers turn 65, it's going to become a larger problem. And the problem with macular degeneration is most people don't know they have it if they haven't had their eyes examined regularly. And with wet macular degeneration, the problem has been that by the time a person realizes that they've lost vision in an eye, it's too late to do anything about it.
What's the story with the swab, though, that I had?
Well, that's the macular risk test, and by using a person's DNA, we can genetically determine their risk of developing the more severe form of the disease, the wet form.
Do I have to go to an ophthalmologist to get that done, or can I go to my regular optometrist? Who gives me the test with the DNA?
Any eye care practitioner can give the test. So basically the qualifications for the test are, one, a diagnosis of macular degeneration, and two, the patient needs to be over 65 currently to have the test covered.
Well, I approached it close enough, and they decided to bend the rules a little bit. Actually, when I came out to Dr. Morgan's office just a couple of days ago, we got a chance to check out the results, and while the pictures that you're about to see are not mine, Dr. Morgan can describe exactly what it is that you're seeing and why it makes a big difference in your life and the quality of your vision. We have the pictures coming up there. What are we looking at now?
Well, Pat, that's a picture of the back of a person with dry macular degeneration, back of their eye. The little white specks that you see throughout the picture are called drusen. Now, in the past, two patients may present with an eye that looks like that. Vision is still fairly good, maybe 20/25, as in this patient's case. Yet, we wouldn't know which one of those patients were at risk to develop the wet form of the disease. With macular risk, if we know which patients are going to develop the disease, we can now see that patient on a more frequent basis to try and catch it early before it destroys their vision. So essentially, we can save their first eye before we allow an eye to go blind before we monitor them more frequently. So in this particular patient, this is where monitoring pays off. This patient was a high-risk patient, and they came in for a frequent check. This is what we found with a device called an OCT, which is basically like a topographical analysis of their surface tissue. The red spot that you see in the middle is actually representative of a blood vessel growing under their retina. The little dark blue hole in the center of the picture, that's the center of their vision, which is still unaffected at this point. And the patient's vision was still very good at 20/25. They had no idea that they had the disease. Now, this is a cross-section of the tissue, and if you look at the left side, you can see where the layers have kind of separated versus the right side. That's where that new blood vessel has grown under the retina and leaked and separated those layers. Now, the good news for this patient is because we caught them early, we were able to refer them for treatment to a retinal surgeon where they had medication administered to the eye and stopped the leaky blood vessel and maintained their vision.
Well, all right. Well, with that kind of treatment, can you actually stop macular degeneration from increasing to a level that would create a loss of sight?
Yes, with that's the beauty of the treatments that we now have with these medications.
You don't just delay it.
We don't. Well, if we catch it early, we can now continually monitor that patient with wet macular degeneration and administer the medication as needed to control the disease and hopefully maintain that person's eyesight.
Okay, and mine, I have the test results here, and I could understand, about a tenth of them. But I
Okay.
was able to read them easily.
Yep. Yes, you came out as the lowest risk category. It stratifies patients into 5 risk categories. Category 1 and 2 are low risk. They have less than a 10% chance that they'll develop wet macular degeneration in their lifetime. Categories 3, 4, and 5, the risk goes up significantly, up to a 65% chance that they will develop wet AMD. Those patients, instead of seeing them once for their annual eye exam, we may see those patients 4 times a year now to monitor them in an attempt to catch the disease early while it's still treatable.
Well, I like the phrase that I remember you using. You said, your results are off the chart. And of course, that gives me a tremendous feeling, particularly because I've always been very, very fortunate when it comes to my eyesight and only having to wear reading glasses for things like newspapers and menus. Is that because my mom and dad both had good eyesight, primarily?
Well, the genetics are a little difficult. You know, there may have been other people in someone's family that have the disease, that over time, as families come together, a person can become more apt to develop the disease. But, you know, yes, in large part, macular degeneration is a genetic disease, so you probably came from some pretty good lines.
So, when I came out to your office, 91st Avenue and Union Hills, right?
Yes,
okay. If I'm going to drive that far, I want to be knocked out by what I see, and I was.
Well, thank you.
I've got to tell you, your office is like the Starship Enterprise, but not in order to impress. You have machines I've never heard of in my life out there, and it's really something. It appears as if you don't just want to sell glasses.
Oh, that's absolutely correct. While, you know, I'm an optometrist, and most optometrists will have opticals in their office, but really that's not what it's about. It's about having your eyes examined, identifying problems early on, and being able to address those problems and treat them before they affect vision.
And that's one of the reasons why when I asked you, you said absolutely an annual visit for everybody, not just so the doctor can put his kids through school.
That is correct. Things that can go wrong, as the example we showed, patients may not be aware of. And if we can catch problems early, whether it's macular degeneration or glaucoma or a retinal tear, diabetes, any of those things, if it can preserve the person's sight, it's well worth that annual visit.
And you know what everybody is saying? They're saying, well, wait a minute, hold it. 91st Avenue and Union Hills, I know where the Dr. Morgan is, but what about the doctors in my area? All you have to do is to check out Arizona Eye Health and that website, that phone number, and you'll find an optometrist near you who can answer your questions. If you're saying, how do I find Linda Whitewolf? She's coming up next with Arizona Native News.
Yes, because we know we have to cut at a certain point and go on to some stuff. On the graphic,